Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Hey, Nita Valens. How are you today?
I'm great. And yourself?
Living it up higher and higher.
Yay. Well, we're going to teach the listeners how to live it up today. If you're having chronic musculoskeletal pain, which basically means orthopedic pain, then you want to call us today at 866-870-5752. And what does that mean? That means muscle pain, joint pain, tendon pain, ligament pain, back pain, neck pain, hip pain, arthritis pain, stiff joints, dull aches, that type of thing. And when you call today, you get the latest book by Dr. Darrow free. It is called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. There's actually 264 scientific studies contained in the book, so you really want to check that out. And you get it free when you call us today at 866-870-5752 right here at the station, 866-870-5752, and you get to talk to Dr. Darrow directly about your pain. It's the best deal in town, really. And I want you to also go to the website, which is www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on video. We're here Saturdays at 10 a.m., again at 1 p.m., and sometimes at different times all over the dial. So if you want to call the office, you've been listening a long time, you're ready to book your appointment, that number is 800-300-9300. The office, 800-300-9300. Do you want to go to the phones, or did you want to talk for a minute first?
It's always a good choice to go to the phones and Mike wait too long, right, Mike?
All right.
That's fine. Thank you, doctor. I appreciate it.
Hey, Mike, you got a lot of noise in the background. If you're driving, try to pull over to the side of the road or get off your Bluetooth, or just talk nice
Let me
and.
do that real quick right now.
But we can talk. Oh, yeah, it's a lot better. Thank you so much. So let's get to the heart of this, and then we can dance around it with other issues. So your hip has been bothering you, Mike. How long has that been going on for?
My left hip has been bothering me for a long time. It's probably been 10 to 15 years.
Okay.
And I've gone to the doctor. I've had all sorts of things done as far as acupuncture. I've tried pain medication. They did MRI on me, and they're saying that I have arthritis in the hip, and that it shows that I would be a good candidate for hip replacement, is what they're saying.
I don't know what that means, to be honest with you. The good candidate means they want to cut your bone off, and amputate it, put in a prosthesis. Right. If you can walk and move around, and I don't agree with that. Generally, I have to examine you to see how much range of motion. But
that's the problem, doctor. At times, my range of motion is very limited. It's hard to tie my shoe. It's hard to put on my sock in the morning.
Okay.
And then, of course, all the compensating, I guess my body's doing it for that. It leads to other problems like low back pain and stuff like that. But I think the crux of it is in that hip.
Okay. Can you walk around okay?
Yes, I walk.
Okay. Then the chances are we can help you get rid of some of that pain and maybe give you a little more range of motion. I have to examine you to see what it feels like. I don't diagnose based X-rays or MRIs, as all my patients know. They get very flustered and they go, why aren't you interested in all of these images that had your doctors do? Well, I am interested in them. It's good ancillary information. But I get so many people with advanced arthritis, so as it's said to be, and then I examine them, and I can't believe how great the joint feels, or whatever part of the body it is. So we have to be careful not to get seduced by an X-ray or MRI or CT scan to decide if we're going to do surgery or not. You have to know that I have a bias against surgery. So when you come in to talk to me, just know I'm going to probably try to talk you out of it immediately, because I've been in so many surgeries in my training that have gone wrong. I am not an orthopedic surgeon. I'm board certified in physical medicine and rehabilitation. The reason I jumped ship from orthopedics was I saw terrible side effects for people. Didn't think it was a good thing. Now, it is necessary for a lot of situations. If you break a bone, it's best to get to an orthopedic surgeon right away and make sure you're safe, and maybe patch that bone up, especially if you have a compound fracture or it's sticking out of the skin or something like that. Get somebody to get you right to the surgeon. But most of these surgeries that are done, in my opinion, should not be done at all. And the results are not great. You're going to get a copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. The studies back up what I'm talking about. I always knew intuitively by seeing patients these surgeries were not a good idea. If you've ever listened to my show before, you've heard me talk about my right shoulder surgery back when I was in med school. I was doing orthopedics, and I literally begged my boss, who was an orthopedic surgeon, to cut my shoulder, and he got me right in. I had a couple of years of pain with it, and it came out terrible. Blame him for it, because that's just what happens sometimes. So we have to be very careful not to do a surgery because we have pain. If your hip was locked up...
That's why I called into your show, because I have been listening for quite a while, and I do like your stance on not doing surgery, and I would like to explore every avenue possible before a surgery would be maybe inevitable or whatever. But
yeah, I mean, the way I look at surgery is it's a crapshoot. You may get a great result, and you may get a terrible result. And if you're the guy that likes to go to Las Vegas and gamble, go get a surgery. I'm not that guy. I already learned the hard way. I've had many things on my body. I've been injecting myself since around, I'm trying to think what year it was, about 1989, I think it was. I've had great success. I've had many spots I really would have thought I should get surgery from, but because I've had good luck with using platelets, PRP it's called, platelet-rich plasma, stem cells, I've used stem cells on both my knees and both my shoulders with amazing, amazing success. If you've listened to the show, you know that I injured my knee about 6 weeks ago or so, and I'm fine. I'm going to go play golf today. Took about 1 week for it took about 1 week for my knee to get me back in order. And believe it or not, I did 4 stem cell injections on my right knee in 1 week, and just got an email from someone. We might get to it today. I doubt it, because we have a lot of callers, where a person says, why do you inject every 2 weeks with your patients? Why don't you wait longer? The reason is because the more we do, the faster you heal. So I generally do it about every 2 weeks with patients. Most doctors do it every few months. They're waiting for all the growth of the tissue. Great, wait all you want, but then your healing takes forever. And I'm not into getting people in the tennis courts and the golf course and back track and back into the weight room and get them healed up and feeling good sooner. When I get elite athletes, they want to inject real frequently. Most patients are happy with doing it every couple of weeks. If I get someone who's really eager get back to their sport, we're going to do it much more frequently. And I know that I'm an outlier with that. Most doctors read literature and they try to figure out how long it takes for a tissue to, and they get lost in science. I don't get lost in science. I get lost in what works. Works is to inject as frequently as you are able to.
Okay. So I'm very interested and very willing. What would be my next step, doctor?
Well, just come on in the office. Just call the office at 800-300-9300. Set up an appointment.
Okay.
That's 800-300-9300. And we'll get you right in. It's kind of nice. Things are busy again. Thank goodness. People are not afraid to come out of their houses anymore. Everybody wears a mask in the office right now.
Right. Okay, very good. Then when we hang up, I will definitely call your office and make an appointment, and I look forward to seeing you in the near future. Yeah,
it'd be great to talk to you. And you can also go to the website, which is www.lastemcells.com, www.lastemcells.com, and we can set something up there also. Okay, so either way. And the website's amazing. It's got videos of me doing the procedures. You can watch them and see if it's something you want to do. Okay. And that's a good start. It's got a lot of information.
Okay, very good.
Thanks for your call, Mike.
And like I said, I look forward. Thank you very much.
All right. Thank you. God bless you, Mike.
The number to call and speak to Dr. Darrow right here at the studio is 866-870-5752. That's 866-870-5752. And we're going to Christine in my hometown, Denver.
Denver, Colorado. I did my internship there a long time ago.
I know, yes.
So, Christine, I understand that your hands are bothering you. Do you have arthritis?
Well, that's what I've been told.
Okay.
But I think it's kind of a trigger finger kind of thing going on.
Okay. So, did a doctor do an X-ray of your hands?
No, not yet, because I'm afraid to go to a doctor.
You shouldn't be afraid. It's good to go to doctors and find out what's going on, get their opinions. You don't have to do what they tell you to.
Yeah, we've discussed the trigger finger, but they've not done any farther with it. But recently, it's the two middle fingers and then my ring finger.
Okay.
If I make a fist, they lock down.
Okay.
Those knuckles lock down.
Okay, well, that could be trigger fingers, or that it could be arthritis also. It just depends. I'd have to look at your hands. Are you in Denver now, or are you in LA now?
I am, but I'm coming to LA in September 5th.
Okay. Well,
very much
I'm glad to see you. The number to the office, if you want to call for an appointment, is 800-300-9300.
Okay, great. Yeah, and I'm going to talk to you about a few other issues, too, about the HRT.
Okay, HRT, for those listening, means hormone replacement therapy. And that means that when women start to lose their hormones, they gain weight. They the way Suzanne Summers talks about it is very funny. I was just watching a video of her last night that she sent to me. I forgot what it's the seven dwarfs, she calls them. Itchy, bitchy, blah, 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 blah. I forget what the others are.
Right.
But it's no fun losing hormones for a woman or for a man. And there's very few doctors I know that know how to treat this situation very well. Most doctors won't even give hormones to women. So it's something we do.
I was on them for a while, but at age 60, they told me I need to come off of them for the cancer risk.
Okay.
And,
well, I don't believe that's true. I don't believe that's true, but
thank you
should. That's just my little opinion. I don't think that hormones cause cancer. I think that if you have a cancer, it will grow faster, and you'll find it faster if you're on hormones. So that's for men and women. With men, it's typically only testosterone. With women, it's typically testosterone, progesterone, and estrogen. We do have to watch the levels. We don't want to give synthetic hormones. We want to give bioidentical hormones, which are healthy for you, the same ones your body produces. But that's a long conversation that we'll have when you come in the office. And before you come in, what we'll do is we'll order the labs for you. And then when you come in, I'll know what's going on already.
Okay. All right. Great. I need
God
to
bless you,
get to the bottom
Christine.
of this because I'm very active, and at 70, I'm very active, and I still snow ski, and I don't want to be slowed down anymore.
Yeah, Denver and Colorado are very sports oriented. I loved it when I was there. Everybody had a roof rack on their car. As soon as the snow would start, they'd be driving up to the mountains.
Oh yeah, and we all have four-wheel drive.
Bike racks. Yep. It's a great place.
Thank you, Christine.
Thank you.
Our number is 866-870-5752. Call here at the station and speak to Dr. Darrow. Find out what's going on with your pain. 866-870-5752. And we're going to Allison in Long Beach.
Allison, you have a question about hormones. How old are you?
I'm 56.
Okay. So you're through menopause already. Have you been on hormones yet?
Yes. So I stopped my period, and then I started having hot flashes. So I went on estradiol, progesterone, and I've started my period again.
Well, do you want to have your period? You don't have to.
I don't know. I don't know if it's good to have it. I know Suzanne Summers. I think I've seen some of her stuff where she's still in that, maybe still having a period, but I don't know if that's
well.
Good
It's up to you. It's up to you if you want it or not. Some women like it because they feel very young, and my sister was like that. She loved when she was in her 70s. She loved having her period. She loved when she was dating that she could say, "I can't. I'm on my period." She was very funny.
Yeah.
But yeah, that's a choice. Cycling like that is more difficult, and getting the hormones regulated it's easy to stop the periods and just have you on a constant daily dose. When you have your period, it's typically changing the dosing on a regular basis. And I personally don't like to do that because it gets more difficult and takes a lot of time to have it regulated properly. So I'm not one who likes to do that, but there are plenty of doctors around who will do it, and it's not needed.
Yeah. Okay. So the other thing that's related to hormones is hair thinning, and
yes, that's typically when your dihydrotestosterone is too high, or there's an imbalance in your hormones. That's something we'd have to look at all your labs. We'd have to order new labs and see what's going on.
Okay. Well, I have reversed it somewhat by taking the hair, nail, skin, or at least I think so. There's a lot of
That's good.
new growth.
Yeah, there's a lot of things you can do. We can put PRP, platelet-rich plasma, into the scalp or stem cells with it. Grow it back way also. You can use some finasteride on your scalp. That's a DHT blocker. There's a lot of different things, but we'd have to look at your labs, and I'd have to look at your head and see what's going on.
Okay. All right.
All right. God bless. Nice talking to you, Allison.
Thanks for your call, Allison. Call the station right now. Talk to Dr. Darrow, 866-870-5752. And I do have lines open for you right now. Let's go to Mary in Torrance.
Hey, Mary.
Mary, turn your radio off, please.
Yes.
Mary?
Oh, it looks like it connected me.
Mary?
What we're going to do, Nita, is we're going to go off the line with her.
And go
to
Donald in Ventura.
She needs to actually call back so the call screener direct her what's going on.
Okay.
So I'd suggest we just cut her off at this point.
Okay.
And then let her call.
Okay.
So, Donald, can you hear me?
Oh, yes, sir.
Good. Got some pain in your hip.
Yeah, I've had that off and on for a number of years, and I've been listening to your program for quite a while. And I just wondered, perhaps I'm also low on my testosterone. I'm 83 and very active.
Okay.
And the only thing I have is an aneurysm, which they watch very closely.
Okay.
Other than that,
is it an aneurysm in your abdominal aorta or your aorta or your heart?
I have to find out where that's located, whether it's in the heart area or in the stomach. I'm not sure. I think it's in the stomach area.
Okay.
In that part.
Well, most of those are not a problem. It's being watched. You should be safe.
Yeah, it's about 2 now. I think it was the last time they checked it. It was around 2. So
yeah, that's not
low.
a big deal from what I think.
And the only other thing was, doctor, I'm just diabetic number 2, but I wonder.
Okay, so that means basically that you're over. Are you overweight, Donald?
Yeah, I consider myself overweight. Yeah, I'm 221 or something like that, and I'm 5'10" and a half.
Okay, yeah, you're overweight.
Yeah.
So to get rid of your diabetes type 2, you've got to stop eating carbs.
Yeah, that's what I understand. Yeah, and then I didn't know, doctor, do you think this testosterone would be effective for me also at my age, or is
yes,
something?
It would help you lower your Well, no, it does a lot of things, but number one, it would help lower your hemoglobin A1C, which is a marker for diabetes, and it would help you lose weight, get rid of some fat, build a little muscle, and it's a great thing as we age because it gets rid of frailty also.
Yeah, exactly.
Now you don't sound like a frail kind of guy.
Yeah,
if you live long enough,
I'm pretty active all the time. It's just
yeah. I just had a 96-year-old gentleman come in a couple of days ago to get injections, and he was in amazing shape. He had a full head of hair. He had good muscle tone. He was 100% with it. He was cracking jokes the whole time. So aging has changed. It's not the way it used to be, and
it's changed quite a bit. Yeah.
I think for men and women, testosterone is one of the most important things we can do to stay young.
I see advertised on TV all the time, this testosterone tablets and so forth, but I've kind of...
Well, the tablets don't do you any good, okay? So don't do that.
Yeah, I've kind of stayed away from that. And the only other thing, I did have a serious... I fell off a ladder. That was in 2000. And this orthopedic surgeon locally here in Ventura just repaired me like I was 18. Since then, I've had no troubles at all with my legs or walking or anything. It's amazing.
Well, you're amazing. You're an amazing man. God bless you.
And I broke an ankle when I fell off the ladder.
And you're still kicking.
And
but anyway, if you want to come in, just call 800-300-9300.
Oh, yeah.
800-300-9300. And we'll get your labs done for your testosterone. Is there any area you're having pain? You mentioned your hip. What's going on there?
Yeah, this local chiropractor did some X-rays and said I had arthritis in my spine. So that's
okay. Well, we have to check out, see where the pain is coming from. I don't trust X-rays or MRIs personally. And too many people get those images done. The doctor doesn't even examine them and sends them right to surgery.
Yeah, exactly.
And I think that's a terrible thing.
And how
I get so many people.
Spelled, doctor, is it D-A-R-R-E-L?
Close. D-A-R-R-O-W.
Oh, R-O-W. Okay, yeah. Okay.
First name M-A-R-C.
One time before, and I've just misplaced it. But okay, well, thank you so much, doctor.
All right. God bless you, Donald.
Okay. Thank you, too. Same to you, doctor.
Thank you, Donald. Okay. Call the station here at 866-870-5752. Speak directly to Dr. Darrow. Talk about your pain. We'll be right back with your calls after these messages. And Mary, you're next. I'm your host, Nita Valens. We'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.
Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at JointRehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls at 866-870-5752 here at the station. You can talk directly with Dr. Darrow about your orthopedic pain, your back pain, your neck pain, your joint pain. It's called musculoskeletal pain, and you get a free book, Dr. Darrow's latest, when you call the program today. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. We are here Saturdays at 10 and again at 1 p.m. And go check the website out at www.lastemcells.com, where you can see videos of Dr. Darrow performing the treatments, and you can email him off of every page. And the number here at the station again is 866-870-5752. I have lines open for you right now, and we are going to Mary in Torrance.
Hey, Mary, Dr. Marc Darrow, how are you this morning?
I'm fine, thank you. How are yourself?
Thank you for calling. Yeah, living it up. I'm happy. So I understand your knee bothers you. How long has that been going on?
Well, my knee, it hurts just sometimes, but I started running again. It seems like it's better when I run. But it's just one knee. It's my right knee. My left hip hurts sometimes. And I have a slight crick in my left ankle.
Okay.
So I was starting to take like MSM and creatine and DHEA.
Okay.
Thinking that maybe it would help improve it somehow. I haven't been diagnosed with anything, but I just know those discomforts that I have. And I started wearing like a knee pad when I run, but that hurts when I wear it. So
well, let's talk about your knee first, because we haven't talked about knees yet today, Mary. How old are you, first of all? That's the best thing to figure out.
51.
5'1"?
5'1", yes.
Okay. By the way, you're a little bit quiet. I don't know if you're on a Bluetooth or whatever. We'd like you to talk a little bit louder. Yeah, just keep you can yell at me. I don't mind. Yeah. So at the age of 51 and you're a runner, we can expect that you're going to have a little bit of breakdown in the tissue of your joints. And there's nothing wrong with that.
I'm not really a runner. Many years ago I ran, but lately to lose weight, I've been trying to run a little bit more, like walk, run. Got
it. So here's a key for you. Every pound on your tummy that's in excess is 5 pounds biomechanically on your knees. That means if you're an extra 20 pounds, which is pretty typical, you're going through menopause and you're going to gain weight unless you start adding on some bioidentical hormones. Every pound is 5 pounds extra on your knees. The average woman gains about 20 pounds or more through menopause, okay? So you have to be careful about that.
Yeah, I think you're right.
Now I can hear you good.
Much better.
Thank you. So that's something to consider. Once we get people back on hormone supplementation, they can lose weight easy. They get rid of the fat. They gain a little muscle. So that's something that you may want to consider. And that's something that we can do with you. Now, in terms of the actual knees being stiff, we would probably use platelets called PRP, that's platelet-rich plasma, Or if it's more severe, when I do your examination, I could tell you we may want to add stem cells to the mixture to regrow some of that tissue that you've worn out. Okay? Nothing wrong with it. It's like, think of yourself as a very expensive Ferrari. The tires are supposed to wear down as you hit more mileage, but we can regrow the tissue there. You know, with trucks, they retread the tires. With human bodies, we retread the joints, ligaments, and tendons by growing back the tissue and rejuvenating it. So you can go to my website at www.lastemcells.com. And you can look at videos of me doing these procedures. There's a lot of science on that website that you'll be interested in reading about. And I've been doing this work about 22 years now, and it started with my own body. I had a miracle healing on my wrist, and then I injected my shoulder after a failed surgery, and I healed my shoulder overnight, and I've been using it ever since. The most recent thing that I did was I injured my knee running too much and playing too much golf in the mountains, and that healed up very well. Just a short while ago by doing stem cells and platelets mixed together. So I have to examine you to figure out.
Would it be my own stem cells, or it would be some that come from somewhere else, some other source?
We have different options, so it depends on what you want to do. We'd talk about it when you come in great detail.
Oh, okay. Until I come in, but do you think the DHEA is a good testosterone replacement for me as a woman who...
No, it won't do a thing. Nope, won't do a thing.
How the reason is kind of testosterone?
No, don't do it. It's a waste. DHEA is a good supplement. Sorry?
What? I'm sorry.
You got to let me talk, baby.
I'm sorry.
I know you're excited. Let's do one thing at a time. The testosterone supplements do not work. How do I know? Because I've tried them. I've done my labs before and after, didn't change anything in my blood. It's got to be, for women, we do it with a cream. For men who have higher doses, we do it with an injection once a week. They can do it themselves. Small needle, I do it once a week. I've been doing it for... Let's see, I'm about 72. I've been doing it since my mid-40s, so almost 30 years. I use a thin needle. I don't even feel it. So it's something for men and women. DHEA is a precursor to testosterone, but you'd have to take a bottle a day. Well, I'm not telling you to do it, so don't do it, to have it convert to testosterone. DHEA in and of itself is a good hormone to take, and it's associated with longevity. People that live a long time have high DHEA levels. So I take that too. I take 50 milligrams a day. But for women, we usually start them off less. If they start at 50 milligrams, their face is going to probably break out. So not something I'm going to tell you to do over the radio. You know, you've got to come in and we talk about it.
How about the potassium? Would that help me?
I'm sorry, say that slower.
Would potassium help me too if I take potassium with DHEA?
Oh, potassium. No, potassium is something you need if it's low. So I don't just throw the kitchen sink at everybody and say buy everything, because you're not going to take them for long. A lot of doctors, when you leave their office, you've got a shopping bag full of supplements. And then you take them for a week or two, and then it doesn't make you feel any better, and then you never take them again. You throw them away. So I'm more specific. We do blood tests to find out what's going on. If you're low, we supplement.
Would I use my insurance at all?
We don't take insurance, darling. Sorry.
Oh, okay.
Doctors that do what's called alternative medicine, which I don't think is alternative. I think it's mainline. But, the traditional docs, which are not traditional at all, everything's backwards on this planet to begin with. Everything that they talk about is backwards. So it's backwards about what's traditional medicine and what's alternative medicine. But my point is, guys who do this kind of work, this natural medicine like I do, I do mostly regenerative medicine, which is injections with platelets and stem cells to regrow tissue. That's most of what I do. But us guys, they call us alternative. We're not alternative. There's so much research on this. We do research on every single patient that walks in our office. And we've got lots of studies that we've published. So we're not alternative, but if the orthopedic surgeons want to call us that and say what we do doesn't work, God bless them. They're entitled to their opinion. I'm entitled to my opinion, and you're entitled to your opinion. Everybody's got an opinion. It's fine with me. Anyway, you need some work, honey. You want to come in, you can call right now. People are waiting by the phones. 800-300-9300. We got a lot of things to talk to you about. You've got issues with your knees and your ankle and whatever else is going on. You've got to lose some weight, and we'll get you there.
Thank you, Mary.
Okay, wonderful. Thank you again.
Bye.
All right, Mary, God bless you. Thank you for calling in.
The number here at the studio to speak with Dr. Darrow is 866-870-5752. That's 866-870-5752. I have lines open for you right now. And check out the website at www.lastemcells.com. That's lastemcells.com. And we're going to Joe in Reseda.
Hello, Joe. You've got a knee that bothers you. How long?
It's been about a week. I was doing a bike ride and I fell. A curb kind of came out and surprised me, and I hit the curb. But it's my left knee, and there's a little bit of soreness on the front on the kneecap. What I'm calling about, which is surprising me, and I'm 59, so I've done a lot of activity. I'm doing a lot of stuff. I generally get out and I'm very active. But what's surprising me more than anything is there's pain and limited flexibility grossly. Sure. I can't bend the knee at all in the back of the knee, in the popliteal area. And it's just, and I'm expecting that I strained the hamstring, that I strained the calf a little bit because when I did the trauma to the knee.
Okay, that makes sense, doesn't it? Yeah, I mean, it's only a week out. Hopefully you can heal up. It would be really smart of you, though, to come in and let me look with an ultrasound. We can look inside the knee with an ultrasound. It's not the kind of ultrasound that heats up the body. It's an imaging study. And if you've got fluid in the knee, which it sounds like you do, we want to aspirate that right out, especially if it's blood. We want to get it out of there so it doesn't coagulate and cause a hematoma, because then you've got a long-term healing ahead. And you may, I don't want to implant negative ideas, but I mean, I have to tell you the truth. When you have a hematoma inside the body, you can lose your range of motion forever. So the smartest possible thing is to take a look with the ultrasound, see if there's fluid. If there is, we just numb it up. It doesn't hurt at all. And we can aspirate out the fluid and get your range of motion back immediately. So I don't know why orthopedic surgeons do not do this. I get a lot of people that have been to an orthopedic surgeon with something like, let's say, an ACL rupture. That's the anterior cruciate ligament in the knee. And I see 100 cc's of blood in there. And it's just left in there. And I just take it out. And the person immediately gets up and goes, "Oh, my God, thank you. The pain is gone. I have range of motion again." So it's one of the most important things we can do is to get the fluid out. So that's something you don't wait, because you've got the loss of range of motion, and it sounds like you may have a popliteal cyst in the back of the knee. Those are so easy to aspirate. You may have, an effusion, which is a fluid collection in the front of the knee too, in the suprapatellar pouch. So those are things that I would immediately get in the office and have me take a look at. I can get you in if you want to come in Monday morning, I'll get you in, because that's something I don't want to have sit there. And if you want to email me, you're welcome to go to my website, which is www.lastemcells.com. And there's a spot on every page to email me. And I'm going to give you out my cell phone right now if you want to call me later. It's 310-666-9977. I want you fixed.
310-866.
Let me repeat it because you got it off a little bit. It's 310-666-9977.
Do you have that, Joe?
Yes. 666-9977.
Right.
You got it.
Okay.
Yeah. Every patient every patient gets my cell number, and I get texted all day, all night, and I talk to people all day and all night. And people say, "What kind of life?"
Your office number is 800-300-9300.
Yeah, but you can, I want to get you handled quick. So I would just, if I were you, I would text me or call me right after the show, and I'll get right back to you if I don't pick up.
Okay.
And
I've been elevating it for the week. I've been elevating it and putting it on ice and trying to do what I can and put the ice. Even though I had the knee injury, like I said, I've been getting an ice pack, and I've been basically sitting on it right on the back of the knee, the hamstring.
You got to be super careful, man, because ice on the back of the knee can kill a nerve. So be very careful. Yeah.
Okay. Yeah, it's not it's just an ice pack.
I got it, but I'm just letting you know. I've seen it happen.
I understand.
And the other thing is, ice may not be the best way to treat your knee right now. It may be warmth. I don't know the answer. Ice can block healing because it constricts the blood vessels. So I'd have to see it to tell you what to do. I can't tell you on the radio. I'm not your doctor till you come in the office. So
you don't have X-ray vision through the telephone and the radio waves?
Honestly, I do, but I'm not going to share what I see.
Thank you, Joe. Appreciate your call.
All right. Thank you, doctor. All right.
I'm right in there with you, Joe.
Thank you so much. Call Dr. Darrow right now. Lines are open for you at 866-870-5752. Right here in the studio, 866-870-5752. And let's go to Jimmy in L.A.
Hey, Jimmy, Dr. Marc Darrow, nice to talk to you. Appreciate your call. How old are you, Jimmy?
Me too.
What's your age? Good. You sound really super young.
I have, a couple of issues. One, you actually diagnosed once on the golf course by just feeling it, the left shoulder. There's a little spot there that hurts if I raise my arm.
Okay.
And the other one is, as of lately, a couple of weeks ago, I was sick and it felt like I was hit by a truck for like 10 days. I took a COVID-19 test, didn't have that. But my calves, my hamstring, all the way down to my foot.
Yes.
It's been a problem lately, and then also going down, up and down the stairs, the knee area, the front and the kneecap as well.
Okay.
Is sensitive, but this is just, in the last probably 3 weeks or so that's been developing.
Okay. Is it related to you is it related to your illness that you had for 10 days?
I think so. I really do. Because my muscles were all sore during that span. I do have some pressure, the left, side of the breast, on the way down, but it's not.
Did you happen to take an antibiotic?
I've been taking Motrin, 2 tablets a day.
Okay. Did you happen to take an antibiotic for your illness?
Oh, I'm sorry. No, I did not take an antibiotic.
Okay, good. There is an association, just so everybody gets to hear this. There's a class of antibiotics called fluoroquinolones, and they can cause tendinopathy all over the body where people just get stiff like you're talking about. That's why I wanted to check that out with you. And it can be very debilitating.
I'm taking metoprolol. I'm taking, a blood thinner as well because I had AFib. I was diagnosed with that about 8 months ago. So
okay. Have you taken any cholesterol lowering medicines? Any statin drugs?
No, I have not.
All right, because those can also cause, just for all you folks listening, they can cause rhabdomyolysis, where the muscle breaks down, and they're terrible drugs. I mean, I don't know why doctors give them to anybody. They can stop the rate of heart attacks, but the research shows that you die anyway. So what's the point? I wouldn't take those drugs. That's me.
But something like Eliquis wouldn't affect it, would it?
I don't think so. That's just a blood thinner, and I doubt it.
Right. Okay. I mean, it's the tightness of the hamstring, the calf sore. The foot. I'll have some sensation and a little bit of soreness there as well. Okay. I don't know. Maybe it's just old age setting in. I don't know.
I don't think that's what it is, because at 66, you don't have what I call old age. I don't know if you were listening to the beginning of the show. I had a 96-year-old man come in a couple of days ago. I injected him, and he's in great shape. I mean, you'd never, ever know. He was mentally 100%. So I wouldn't get lost in ever talking about yourself as getting older, because I don't think we're going that way anymore. I think there's been a change on the planet.
The one, like I mentioned on the golf course, you put pressure on it, the inside of the shoulder area, and he said, well, one treatment would probably help that. And that was just a little while ago. But this just recently developed, so.
So I met you on the golf course?
Yeah, at Mountain Gate. Yeah.
Oh, okay. Okay, great. Cool. Yeah. Are you able to keep playing golf? Or
you don't look like you're 72, let me tell you. I was surprised when you mentioned that. But you're in very good shape. But
well, you know what they say about me? They say I'm full of something I can't say and vinegar. Maybe some of you guys will know what that means.
Actually, he's happy in his work, so he looks young.
Nita had to smooth it out there for me. No, but it's true. People all the time, when they find out how older I am, they go, why are you still working? Why don't you retire? And I go, because I'd be miserable. I love what I do. It's not work.
Yeah, it's awesome.
This is the greatest gift I've ever been given of being able to work with people and watch them heal. And, to be honest with you, I was ordained in 1973 with the blessing of healing. And I was a lawyer at the time, and I didn't understand what that meant until years and years and years later. And I know there's a wonderful thing in my office watching people heal, and I'm just so grateful, I can't tell you. And Jimmy, if you want to come in, I'll take a look at you for free. Or if you want to meet me out at the golf course, I'll do that too. I'm going to be out there at 1:24 today on the South Course.
So they opened up the South Course, huh? Because it was closed for a while.
Oh, it's all opened up now. Yeah.
It is. Thank you, Jimmy. We appreciate your call.
All right, thank you. Appreciate it.
God bless you, Jimmy. Get a hold of me. You heard my cell number. Give me a call.
Awesome. Okay, call the studio right now, 866-870-5752, and let's go see what's going on with Frank in Ontario.
Hey, Frank, Dr. Marc Darrow, if you don't mind pulling off the road and getting off your Bluetooth, we'll be able to hear you better.
Yes, I was enthralled in the conversation you had with the...
Oh, Frank, I'm so sorry. We are completely out of time. Go to the website, www.lastemcells.com, and email Dr. Darrow. He'll get back to you. Thank you, Dr. Darrow. Thank you, Alex.
God bless you, Nita.
Bless you, too. Thank you, Alex. Thank you, Suzette, and everybody who called and participated today. And you've been listening to Living Pain Free. We'll see you next time. And remember to listen to The Pet Show with Warren Eckstein, 11 to 1 Saturdays. Bye-bye.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300.